Hello, health advocates. Dr. Lew is here from the Health and Wellness Pod. Another video about glaucoma, eye problems, diabetic retinopathy, cataracts, and this one. So today we are focusing on glaucoma. These symptoms of this condition can actually be confused with the thyroid problems. So we have this popping eye and there's a lot of pressure in the eye. And yeah, we'll talk about the thyroid problem someday so that you can actually get to understand your thyroid. However, in this video, we are focusing on glaucoma, okay? And most times when you ask people about the definition of the disease glaucoma or the condition called glaucoma, even the health practitioners will say it is an increase in the internal pressure of the eye. So the IOP, increased intraocular pressure. That's the definition. But the truth is, we can have an increased intraocular pressure without having the glaucoma. So glaucoma is degenerative optic neuropathy, which means the degeneration or destruction of the optic nerve. Okay, so that can actually exist with both the normal pressure in the eye or high intraocular pressure. So that is the definition for glaucoma. But look at it this way. This is just a general structure of the eye, and I've actually done a transverse cut of the eye so that you can actually see the bigger picture. So we have two fluids here. The one that is behind the lens is called the vitreous humor. The one that is in front of the lens, which is a little liquid, because this one is more of semi-solid, a little bit thick or viscous. But this one that is little liquid is actually called the aqueous humor, and that is what we will focus on. Now remember, glaucoma we have two, the two groups. We have the open angle, which is the most common and is chronic, and then the closed angle, which is acute. And now I'm going to focus my energy on the acute one because this one can be problematic, okay? So what happens in this? So let's cut this so that we can actually see the bigger image here. Now remember, this aqueous humor is coming from somewhere, okay? The same place where the cerebrospinal fluid is coming from, the same place where saliva, where tears are coming from, is the same place where the aqueous humor is coming from. It's actually made from plasma. So the filtration of blood in the blood vessel that leaks out plasma, and the plasma is shed into the ducts. So this is an exocrine gland. When I say exocrine, I mean it has ducts. The endocrine ones, they release their hormones into the bloodstream directly, so they don't need the ducts. But the exocrine glands, we've talked about this before, they have ducts that carry the excretions or the secretions of the gland from the acinas. So this is where we secrete our aqueous humor. Once it has come into the ducts from the blood plasma, this is where we modify it, and after modifying it, we send it all the way into the eye for us to get the benefits of this. But I want you to see, so when we cut this into half, you will see this. Where these ligaments that support the lens are attached to is called the ciliary body. So therefore, the ciliary body is the one that actually produces the aqueous humor through the epithelial cells. Remember, these cells that are lining these ducts are the epithelial cells. So the epithelial cells that line the ciliary bodies are the ones that produce the aqueous humor. And once they produce that, because we have blood vessels lining here, there's that filtration of the plasma, we release the fluid, it is modified in the epithelial cells, and now we have aqueous humor, and now it is released into the eye space. Now I want you to see this. This flow of this aqueous humor comes from these epithelial cells and then flows all the way and is drained out through this like a hole. It's called an angle. And this angle, this here is the iris, and this part that is shaded here is called the cornea. So the iris and the cornea, there is a connection here, and this angle is called iridocorneal. Irido for iris, corneal for cornea, angle. So it is the iridocorneal angle. That is the one that drains this aqueous humor back into the venous circulation. So this is the veins, the blood vessels that carry the oxygenated blood. So it drains it into the venous circulation and goes back into the circulation. And this is just how that flows, so that you don't have an excess of this fluid building up in the eye and increasing the pressure, and now you feel like your eye is popping out. So when we have this normal flow of this fluid, there's no interruption. That is how the eye is supposed to function. However, there comes a time where we have this iris being distorted in a way that it comes in and inhibits the flow of the aqueous humor into the angle so that it can actually be drained into the venous circulation. This is what we end up calling the closed angle glaucoma, because once you block this drainage, what happens is this aqueous humor starts to accumulate here, and when it accumulates here, it increases the intraocular pressure, and this intraocular pressure destroys the optic nerve that supplies the brain from the eye, and now you have the blindness, and now you have the problems. Okay, so that is what we call glaucoma. Now you will see that most of the medication that you're using are actually acting according to where this aqueous humor is coming from, trying to open up this angle, and you see that's how the mode of action is. And some of you who are using like a very common drug that like timolol, you will see where it works in terms of easing up the pressure in the eye. Okay, it's a beta blocker, so you will see. So if you've understood that, you will now know that if we want to reduce this pressure, we must reduce the aqueous humor. This one. So if we want to reduce the aqueous humor, we must make sure either where we are producing it, we've stopped the production, or we reduce the production, or we increase the drainage by opening the angle so that this fluid is drained out into the venous circulation and the pressure goes down. Because once the volume of the aqueous humor goes down, the pressure now falls, and now the eye goes back to normal. Okay, so that is how this process comes to happen. Now I want you to see this. Most drugs that are acting on this process, they either act at the ciliary body where we are producing it, or they open up this angle, or they block some enzymes that are responsible for the formation of the aqueous humor. And now that is exactly what I'm going to talk to you here, the pharmacology or the medications and the medication classes that are used in management of glaucoma. Number one, you must constrict the blood vessel. Why? Because if you constrict the blood vessel, remember, the aqueous humor is coming in from the filter that is coming from the blood vessel, right? So this filter that is coming in here to be drained into the ducts, if you constrict this blood vessel, what will happen is we will have limited filtration of the plasma to produce the aqueous humor here. So therefore you will have reduced aqueous humor here. Okay, so the production will be reduced because you've constricted the blood vessel, and now the filtration has actually gone down. So the blood flow goes down, the formation of the aqueous humor goes down, and the intraocular pressure goes down, and that's how you recover from glaucoma. So the drugs that actually cause this constriction are what we call the alpha-1 agonists, because alpha-1 receptors are on the blood vessels. When you activate them, you constrict the blood vessel. Once you constrict the blood vessel, there is no filtration, there is reduced blood flow, and there is reduced filtration, and therefore you have reduced production of the aqueous humor, and the pressure in the eye falls, and glaucoma is actually starting to go. And the drugs that are actually acting here, the alpha-1 agonist, one of the most common one is called apraclonidine. Okay, so let me write it here. So alpha-1 agonist, we have apraclonidine. Now, if you have a drug that you're using for intraocular pressure and you see written on apraclonidine, understand that this one is actually acting here. Another one, of course, the obvious one is epinephrine. These ones are called the alpha-1 epinephrine. These ones are called the alpha-1 agonists. They constrict the blood vessel, they reduce blood flow, they reduce filtration, and they reduce the production of aqueous humor, and the intraocular pressure falls. And that's basically the mode of action of the first group of drugs, the alpha-1 agonists. Number two, we have drugs that are called the beta blockers. Beta blockers, these drugs that end with the word LOL, the suffix LOL. You've known of drugs for hypertension, the propranolol. So those that end with lol, the carvedilol, those ones. Some of those drugs can be used to reduce this intraocular pressure. And the most common one here is called timolol. So most of you have seen that drug called timolol. Okay, that one. We also have bimatroprolol. Okay, and then there's another one called what is the name? Betaxolol. Yes, betaxolol. All of them are beta blockers, and they come in. And the beta blockers are interesting because they are here at the duct level. So you see, when we are trying to modify the plasma so that we can form the aqueous humor, the receptors that are actually involved in that modification are the beta-1 receptors. So if you block the beta-1 receptors, you will not modify the plasma, and you will ease up on the production of aqueous humor. But that has to go hand in hand with the alpha-1, because alpha-1 will reduce the filtration, and then the beta-1 will block the modification of this. Okay, so that is where timolol falls. Number three, we have an enzyme that is involved here again in the formation of this aqueous humor. And this enzyme is the one that actually combines carbon dioxide with water to form weak carbonic acid. That enzyme is called carbonic anhydrase. So it's very important information of the aqueous humor. But because we have enough of the aqueous humor and it's causing us problems, we want to reduce the formation of this aqueous humor. So therefore, we have to block the carbonic anhydrase enzyme so that we don't form excess of this aqueous humor. And one of the drugs that is involved here is called acetazolamide. Okay, so we have two drugs that block the carbonic anhydrase enzyme. We have acetazolamide, and then we have another one called dozolamide. Pharmacy students will benefit so much from this because of the mode of action of these drugs and how they act, because you don't have to cram. You simply have to know how the aqueous humor is formed. Once you know how the aqueous humor is formed and how it's drained, you will now focus on where it's coming from and now act accordingly because of the receptors. You block the receptors or activate other receptors to just modify the amounts of aqueous humor that is coming out. Now, there's another one. Remember, these ones are just stopping the production, right? Now we have the drainage. So at this angle level, there are drugs also, or there are receptors that actually can help you here. One of the receptors is the PGF2 receptor. Remember, PGF2 are those prostaglandins that actually play different roles in the body. Some of them can be modified to form drugs or analogs that are used to induce abortion. You know that? But this one, the drugs that are acting here, they have to activate this receptor so that we open up the angle. Once you open up the angle, we drain the aqueous humor. And we'll never have to worry about how much you're producing because we'll have the angle open and now all this is draining out and the pressure falls. And which drugs are these? Of course, the PGF2 are the bimatoprost, the carboprost, if you know those drugs, latanoprost, they act here. So I'll put them here, maybe two, latanoprost. And number two is bimatoprost. Those that end with prost. By the end of these lectures, of course, some of you, most of you will become doctors on their own. So every time you are reading on that medication before you use it for the eye, look at if it has these, look at what active ingredient is in that drug. Once you see the active ingredient, you'll know where it works on this, okay? So these are the ones that actually open up this angle. But again, there's another receptor on this angle, the alpha-2. Remember, here on the blood vessels, we had alpha-1. Now here, on the angle, we have alpha-2. And the drugs that are used here, possibly one drug that is very common is called alpha-gun. The trade name is alpha-gun, alpha-gun, okay? But that drug, its generic name is bromidine. So normally it's called alpha-gun. So these are the drugs that actually open up this angle, so we improve the flow of this blood, of this fluid, the aqueous humor, into the venous circulation. And after that, we don't have to worry about it accumulating and causing an increase in pressure. Now, understand that this drainage is also activated, or the force behind this drainage is from the parasympathetic nervous flow. Okay, we have two. We have the sympathetic and the parasympathetic. The sympathetic is one that is actually causing here the constriction, but the parasympathetic is the one that opens up this angle so that we improve the flow. And therefore, there are drugs that can actually be used. They are called the parasympathomimetics. They mimic the parasympathetic system, so they enhance the action of the parasympathetic system. And one of those drugs is called pilocarpine. Pilocarpine. So pilocarpine is one of the drugs that is a parasympathomimetic. By the word mimetic, it means it mimics the parasympathetic system. There's also another drug that is commonly used in theaters that is called the physiostigmine. So these two are drugs that actually enhance here. So for the drainage purposes, we can use the PGF2 receptor agonists, or the analogs, latanoprost and bimatoprost. We can use the alpha-2, which is the bromidine, aka alpha-gun. We can also use the parasympathomimetics, the pilocarpine and physiostigmine, to empty or to drain the fluid into the venous circulation. For the production, we can use the alpha-1. Once we use the alpha-1, we block the blood vessel, we constrict it, so there's no filtration. We can also use the beta blockers here to just block the formation, and we can use the carbonic anhydrase inhibitors to block the formation of this. Once you block the formation of this, of course, this will not be a problem because we'll reduce the pressure because we're not bringing in more of the aqueous humor. And when you open up this, of course, everything flows out and the pressure falls because the volume has gone down. So this is the closed angle glaucoma, and I hope you've learned something from this. But however, as a parting shot, I want you to see this, that nerve problems are sugar problems. So when we tell you about inflammatory foods, specifically the sugar in all forms, including fruits and honey, we are trying to tell you that we can destroy this optic nerve by sugars. Okay, we can also destroy the retina through sugars. We call it diabetic retinopathy. So sugars are very dangerous to nerves. They destroy the nerves totally. So avoid sugars, avoid inflammatory foods that end up destroying your nerve. And nerves are covered by something called the myelin sheath. That is cholesterol. So enhance the cholesterol foods. Eat the fatty meats. Enjoy the saturated fats, the ghee, the tallow, the coconut oil, the lard, the sweat. Use them, the animal fats. Use them for making your meal so that you can actually supply enough cholesterol to make more myelin sheath that will actually help you in terms of regeneration of this. And also go ahead and fast. Prolonged fasts help you produce something called the BDNF, brain-derived neurotropic factor, that is coming in not only to fix the brain cells but also to fix the nerve cells. Okay, so that is very important in these conditions because it actually helps you prevent the degeneration of the nerve and also helps you to rejuvenate some of the nerves that are actually messed up. Okay, so that's how diets play a role here. So sugar is a criminal in these ones, and therefore avoid sugar in all forms. So this is the closed angle glaucoma, and I hope you've understood something here. Next time we'll talk about possibly the open angle so that we can actually compare the two and you see where the difference is. I hope you've learned something new. We'll see you in the next.